Hello guys, what's up? Luis Gonzalez, KINGFISHER'S TV. Good morning! So, matagal nating pinagplanuhan itong pagpe-present natin sa massage therapy. So, ngayon, umpisa na natin ang ating live. So, let's talk about massage therapy. So, a brief history of massage therapy. So, pag-usapan natin yung history of massage therapy as an introduction sa ating pag-aralan ngayong umaga. Introduction. It seems to be a universally instinctive response that we should rub an area of our body where we are experiencing soreness or fatigue. Prehistoric cave painting in the environs dating to BCE 15,000 appears to depict some form of therapeutic touch, but it's difficult to say exactly when and where massage practices first started to be performed in any kind of methodical way. Ancient literature, artwork, and archaeological evidence reveal that massage practices existed in many ancient cultures such as India, China, Egypt, Greece, the Roman Empire, Japan, Thailand, and Korea. In English, the word massage is directly borrowed from French. Earlier origins of the word may stem from Arabic, massa, meaning to touch, feel, on the Greek verb masso, meaning to knead, to handle, to work with the hand. However, the word that ancient Greek used when referring to massage was anatripsis, rubbing up, and Latin word was frictio, or rub. So, massage practices from Antiquity to medieval times. 3,000 to 700 BCE or before Common Era, Shatapatha Brahmana is an ancient Indian Vedic text, the exact date of which a highly contentious. Several scholars suspect that the oral tradition of the text date to 3000 BCE, while it may have been written down until about 700 BCE, with a final version being produced in 300 BCE. The text describes Vedic history, mythology, and rituals, including those with sacrificial fire. In the text, it's written that the sacrificer is anointed as such, a rubbing down the sacrificer with all manner of sweat placed before sprinkling him with fat. Some scholars believe that the text references to the position of the Critikas, the open circular presage, indicate that the voice behind the prose of text belonged to someone who would have been observing the stars around 3000 BCE. Thus, some scholars suspect that the oral tradition of the text dates approximately to that time. So, next ay okay. So this is the text. So from 1000 to 100 BCE, India, chapter 31 of the Sukrata Samhita, an ancient Sanskrit Ayurvedic medical text. Discusses the use of sesame seed. Sesame seed, may problema itong kuha natin. Saglit lang. Yun. Ancient Sarkrita, Ayurvedic medical text, discusses the use of sesame oil and the ghee, clarified butter, for massage purposes. The text likely originated as oral tradition around 1000 BCE, with the written text being completed anywhere from the 6th to 1st century BCE. Additionally, a Buddhism text called the Kandaka, dating to 400 BCE, lists massage practices that Buddha deemed either acceptable or inappropriate. And the Mahabharata, an epic legendary text also dating to 400 BCE, describes a lavish scene in which a prince is massaged by 108 servants in his bathing room and is then washed with sweat-scented water poured of golden pots. BCE 8 to 2nd centuries, Homer, Iliad, and the Odyssey make reference to the practice of massage with oil and fragrant substances to aid wound healing and relieve muscle aches in tired warriors. A later ancient Greek writers such as Hippocrates, Aristotle, Lucian, and others several that deep friction massage is of muscle with olive oil was a commonly employed therapy for Greek athletes, and oil, kept in amphorae, was provided to all who attended gymnasia and athletic festival. Hippocrates wrote that the physician must be skilled in many things, and particularly friction massage. Then, in BCE 722 to 481, massage is referred to in 30 chapters of the earliest Chinese medical text called the Huangdi Ni Jing, a compilation of the known Chinese medical knowledge up to the time, and which became the foundation of traditional Chinese medicine. The knowledge contained in the text, however, is believed to originate in time of the Yellow Emperor, 2711 to 2598 BCE, which predates written Chinese history. BCE, or 7th century, Japanese monks traveled to China to study Buddhism. They were exposed to Chinese massage practices, which the Japanese later developed into their own style of massage called Anma. Anma eventually developed into practice known as Shiatsu, which uses massage to balance energy in the body. And next, is the Jivaka Kumaravaka, BCE 500, also known as Shivago Kumarpa or Dr. Shivago. Wait lang at may check lang tayo kung okay ba yung stream natin. So far, okay naman yung stream. So, tuloy-tuloy lang tayo. Sensya na kayo sa interruption. I just want to make sure that our live is connected to one of you. So, let's continue. BCE 500, Jibaka Kumarabaka, also known as Shibako Kamarfa or Dr. Shibako, was the Buddha personal physician and founded traditional Thai massage, Nuwad Boran. He based Thai massage on a combination of Indian Ayurvedic and Chinese tradition, including acupressure and assisted yoga postures. Rather than using oil, the massage recipient remained clothed, and instead of being rubbed, the body is pressed, pulled, rocked, and stretched. So, si Dr. Shibago ang naka-imbento o nagpaumpisa ng Thai massage. At the year of BCE 493, the book of Esther in the Christian Bible, Old Testament, and the Jewish Tanakh document the beauty regimen of women who were presented in the Persian KINGFISHER'S 1, also identified Ahasuerus, including treatment with oil and myrrh. So, next slide. At the year of 100 to 44 BCE, Roman Emperor Julius Caesar was known to suffer from sudden bout of weakness, convulsion, and fainting. In his time, this was chalked up to epilepsy. Seen by the Romans as a sign of divine possession, modern scholars now believe his symptoms are more likely attributable to a series of mini-stroke. After such episode occurred, Julius Caesar would receive massage treatment to support his recovery. At the year of 327 to 325 BCE, Alexander the Great campaigned in India, during which time Alexander and his soldiers were exposed to Indian massage tradition and brought them home with them to the kingdom of Macedon. From his time forward, Indian massage tradition were gradually incorporated into Greek, Roman, and Turkish practice. Next slide. At the year of 130 to 210 CE, so Common Era, Galen Alius or Gladius Galenus was a revered Greek physician and philosopher living in the Roman Empire. He served as personal physician to Septimius Severus and several other emperors, as well as the gladiators of the high praise of Asia, to whom he administered massage with olive oil. Galen was a prolific author of medical texts that summarized and expanded on either Greek medical knowledge, some of which include discussion of many health benefits of massage. However, Galen texts were not translated into Latin during this time. As the Roman Empire fell, the period known as the Early Middle Ages firmly referred to a Dark Age, roughly 5 to 10th century CE. Galen, as depicted, and by 18th century began the study of Galen texts and ancient Greek medical knowledge, including engraver George Paul Vash Greek massage. Practically disappeared from the medical practices of the Latin West. True massage continues to be practiced to a lesser extent by folk medicine women, midwives, and nuns, who began to take on the role of caring the sick. Meanwhile, Galen works continues to be studied and preserved in Byzantium. The most the mostly Greek-speaking remnants of the Eastern Roman Empire. So next slide. At the year of 581 to 600 CE or Common Era, China. So let's go to China. I will drink my coffee first. Okay. Dr. Sansi Miao, dubbed the King of Medicine of the Su and Tang dynasties, developed 10 new massage techniques and systematized the treatment of childhood diseases. With massage therapy, the Chinese Office of Imperial Physician established the development of massage therapy. During this time, Chinese massage practices, then called Anwu, became popular in Japan, Korea, Vietnam, and the Islamic world. At the 7th and 8th centuries, the Byzantine region of Syria and Western or Mesopotamia began to be conquered by Arab Muslims. After 750 CE, Muslims began to have Syrian Christian make the first translation of some of the Galen works that Greek to Arabic. This sparked a renewed popularity and spreading of the knowledge of Galen and Greek medicine, including through the medieval and early Islamic Middle East. Next slide. At 980 to 1037 CE, the Avicenna or the Avicenna was the Persian physician, astronomer, and philosopher who is now regarded as one of the most significant minds of the Islamic Golden Age, comparable to Italy, Leonardo da Vinci. So ito pala si Avicenna is halos kapareha ni Leonardo da Vinci, who lived centuries later. He produced over 450 writings consisting of a systematization and compilation of the Persian and Greco-Roman medical knowledge that had been translated into Arabic up to his time, and in which Avicenna expanded with the inclusion of his own medical insight. One of the Avicenna's most famous of these texts, the Canon of Medicine, included instruction on what began the established precedent, with the logical assessment of condition and discussion the use of analgesic substances and massage for pain relief. So next. This text was influential that became a standard medical text in many Western and Eastern medieval universities and remained to use until approximately the year 1650. It is thanks to Avicenna that Arabic translation of Galen writing that knowledge of Greco-Roman massage and medicine were not lost but were instead revived in both the Islamic world and Christian West. The renewed interest in ancient Greek and also Latin texts eventually inspired a new era of innovation in medicine, art, and technology in Europe, the Renaissance. The Renaissance and the Enlightenment in 1316 CE, the Bolognese physician Mondino de Luzi reintroduced the public practice of human cadaver dissection. He published the first modern treatise of human anatomy, the Anatomia Corporis Humani. In 1368 to 1644 CE, Ming Dynasty at China, the Chinese massage tradition flourished and became known as tuna. Many texts of tuna were written during this time, especially on pediatric application and diagnosis and treatment. Techniques were further relieved. Tuna maintained its growing popularity almost continuously up to the present day. Next. 1510 to 1590 CE, French military surgeon Ambrose Farey favored the use of massage to enhance the recovery of orthopedic surgery patients. He also classified several types of massage movement. At 1543, Flemish physician Andres Vesalius established the foundation of human anatomy in the West. Through his work, De Humani Corporis Fabrica, on the fabric of the human body. In 1569, Italian physician Girolamo Mercurialis wrote the first text on the field of sports medicine, including massage, the Arte Gymnastica. In 1584, while teaching in Cambridge University, English physician Timothy Wright published a medical text in two parts, Hygienia on preserving health and Therapeutica on restoring health, which encouraged the use of bath, exercise, and massage for good health. In 1600, the Japanese publication Sanchu to Hyu provided introduction of passive and active massage technique. Next slide. So, in 1608 to 1679 CE, Italian physiologist and physicist Giovanni Beroli performed multiple animal dissection and made study of study of biomechanics, likening animals and human bodies to machine. He was likely the first to have introduced the concept of movement in a function of muscular contraction. Next slide. Let's see first. Tuna. Okay. In 1628, priority to this date, most Western physicians believed that the lungs were responsible for moving blood through the body. But then English physician William Harvey observed that it was instead the heart and the blood vessels that were responsible for circulation. The new understanding illuminated the circulatory benefits of massage and further its acceptance as a therapeutic practice. Next slide. In 1728 to 1797, Samuel Auguste Tissot was a prominent Swiss physician who enjoyed the high regard of Napoleon Bonaparte, and whose philosophical argument was repeated by Kant and Voltaire. Strangely, Tissot gained great notoriety in his time for writing an entire medical treatise on the supposed ill effect of masturbation. Fortunately, he also went on to publish several works on gymnastic exercises and use of massage for treating many illnesses. The modern era. So let's talk about modern era. In 1776 to 1839, Per Henrik Ling was a Swedish physiologist, educator, and pioneer of physical therapy. Having found that fencing and physical activity relieve his symptoms of gout, he became keenly interested in the benefit of physical fitness. Ling immersed himself in Franz jail. Then his system of gymnastics and established a gymnastic institute in Sweden in 1804. After completing further self-studies of the entire curriculum of medical doctor, he established his own system of gymnastics called medical gymnastics. He also invented several pieces of equipment that we now more commonly associated with the word gymnastics. The box horse, wall bars, and beams. Ling medical gymnastics included calisthenics, stretchings, and to a lesser extent massage. In 1813, he founded the Swedish Royal Central Gymnastic Institute, and his system of gymnastics gained national recognition. Since that time, he has often and controversially been true as the father of massage, and the developed Swedish massage has often been attributed to him. However, this credit is not exactly correct, as the massage technique in his gymnastic were never codified or meant to be practiced independently of his whole gymnastic system. So, next step is the founder of the system of Swedish massage was Johann Georg Mesger in 1838 to 1908, a Dutch physician who had a similar interest in gymnastics as Ling. At the time, France had translated several Chinese books on massage into French, which was the international language of the 19th century. Mesger practiced French or friction method on patients with minor sprain, and in 1868 wrote his doctoral dissertation, The Treatment of Dysphoria Pedis with Friction, which became the basis for Swedish massage, combining French massage technique with his medical knowledge and using the common French founder of Swedish massage terminology. Mesger developed the 5 techniques and which Swedish massage is known: effleurage, the long gliding stroke; petrissage, kneading of the muscle; friction, circular rubbing motion; tapotement, tapping or percussion; and vibration, shaking of the muscle. As a doctor, Mesger was a better position than Ling to promote massage on a medical scientific basis, and his services became widely sought by European royalty and nobility. Mesger famously used massage to treat a major hip injury suffered by King Gustav V of Sweden with a great success. Next slide. So, on that year of 1838 to 19, um, George, Johann George. Okay, that is George. Next. So, Hasignasin. 1888, in Washington, D.C., Hasbig Nissen opened a Swedish health institute for the treatment of chronic diseases by Swedish movement and massage, the first massage school in the United States. In 1894, in response to the prevalence and untrained and unqualified members of the public offering questionable massage services, the Society of Trained Masseuses, now known as the Chartered Society of Physiotherapy, was founded in Great Britain by 4 nurses. The society developed a board certification program and emphasized a medical model of massage therapy training. Graduates of the program administered massage to World War I casualties, and by the end of the war, the society already had nearly 5,000 members. In 1852 to 1943, John Harvey Kellogg, a popular American doctor and developer of dry cereals, such as cornflakes, contributed to the general public enthusiasm for massage. His book, Art of Massage, a practical manual for the nurses, the student, and the practitioner, was published after his death in 1943. In 1936, a lymphatic drainage massage was introduced by Dr. Emile and Astrid Boder in Paris. They are married. In 1943, the American Association of Masseuses was created in Chicago, and in 1983 was renamed the American Massage Therapy Association, or AMTA. The AMTA now has over 58,000 members. In 1956, the first official tuna training course was established in Shanghai, and by 1978, they were whole hospitals completely dedicated to traditional Chinese medicine, or TCM, including tuna, and all other hospitals include TCM department. In 1987, the Chinese National Tuna Association was established. In 1984, at the Olympic in Los Angeles, sport massage was made available to all athletes for the first time. So, in 1985, chair massage was introduced by David Palmer. In 1991, the Canadian Massage Therapy Alliance, CMTA, was formed. In 1992, the American Massage Therapy Association established the Standard National Certification Examination for Therapeutic Massage. In 2003, the Federation of Massage Therapy Regulatory Authorities of Canada was established, or the POMTRAC. represent the provincial agencies and regulate massage therapy under legislative authority. Its members include the Colleges of Massage Therapists of British Columbia, Ontario, New Brunswick, and Newfoundland and Labrador, which regulate the practice of massage therapy in their respective provinces. In other Canadian jurisdiction, in 2005, the Federation of State Massage Licensing Board was established in United States. And footnote. Note that PCE before the Common Era and newer convention of the chronological notation is used in this text, referring to the time before the life of Jesus Christ, that is the BCE, save only years 1998 from the form of traditional Chinese medicine, including tuna, were largely discouraged by doctors who trained in Western medicine, were also temporarily banned under the leadership of Mao Zedong. So that's it. References. You can see here some references from this presentation. And this one. And here. So thank you for watching. Please click the subscribe button and the notification bell. And please follow also my Facebook page, KINGFISHER'S TV Therapy Channel. And please follow also my sports YouTube channel, KINGFISHER'S TV. So, tignan natin kung meron tayong mga nagpapa-shoutout. So, that's it for today. Thank you. Asahan pa ninyo na marami pa tayong lalabas na mga discussion about massage therapy. Thank you so much and God bless. Thank you so much. Bye-bye.